The key is these are official figures, because the worry is the actual death toll may be much higher, because more and more anecdotal evidence, reports from crematoriums suggest that the death toll could be higher. Remember, this time the reality of COVID deaths is striking rural India as well. Locals in Uttar Pradesh and Bihar last week saw bodies of the dead float in the river. TV screens and social media ran harrowing images of scores of unidentified bodies on the banks of the river Ganga. The administration in UP claimed that they had got the situation under control. But today, right at the top, we're going to give you another reality check. One that puts out a very different story. One that once again exposes administrative apathy. India Today, Shivendra brings us tonight's top story from Prayagraj. I want to warn you, some of the pictures may be distressing.
India Today has been reporting on the situation along the Ganga, about those unidentified bodies that have been floating down this, the holiest of holy Hindu rivers. But there was more that India Today team saw on ground. Visuals that depict the harsh reality of COVID-19. Hundreds of bodies not just floating down the river, but seen buried on the banks. As far as the eye can see, buried in the grey sands of the Ganga are bodies of human beings.
हाँ वहाँ से लेके वहाँ तक पूरा गड़ी है।
तो कितनी बॉडी होगी अंदाजा बताओ?
अरे अंदाजा 1000-2000 होई होगा, ज्यादा ही होई कम ना होई।
अच्छा।
पूरा यहाँ से लेके ऊपर तक गड़ी है।
तो हर साल तो इतना नहीं होता है?
अब करी ज्यादा मरे होली के बाद से ना आदमी।
अच्छा, मरा ज्यादा कोरोना को।
हाँ।
Covered by red cloth marking the burial site, most of the bodies are that of suspected COVID victims. A sight almost dystopian in scale.
आप गिनिए और देखिए कि अव्यवस्था का क्या आलम है कि सड़कों पर जो लोग दवाइयों और तमाम दूसरी असुविधाओं के लिए भटक रहे थे, आज वो जब उनकी मौत हो गई है तो उनको प्रशासन ने ये भी इंतजाम नहीं किया कि उनका अंतिम संस्कार ठीक से हो सके। तो 1 किलोमीटर के दायरे में जितनी भी जगह नजर जाती है वहां सिर्फ लाशें और लाशें ही हैं। अब सरकार ने कहा है कि इस पर रोक लगाई जाए, तो अब यहाँ पर अंतिम संस्कार भले ही कोई न हो रहा हो, लेकिन ये यहाँ पर अधखुली लाशें बता रही हैं कि यहाँ अव्यवस्था का आलम क्या रहा होगा। कैसे प्रशासन आंख बंद किए यहाँ पर बैठा रहा और एक के बाद एक यहाँ पर लाशों के ढेर लगते रहे।
As India Today made its way through the burial sites, the locals confirmed that the practice of burying the dead isn't new. But the coronavirus pandemic has forced those without resources to choose a sand burial or even sometimes a water cremation. Now the government has instructed men to patrol the river and prevent people from burying the dead or dumping the bodies into water. But the locals raise a new concern.
आपको लगता है बारिश होगी तो ये फिर से पानी में आने की आशंका है इनको?
हाँ, ये फिर से पानी में आ जाएगी। अगर ये बारिश बहुत ज्यादा हुई, कटान करेगी गंगा तो आ जाएगी।
Yesterday we showed you how those who can't afford firewood were burying their loved ones here, right under the nose of authorities. Today we report that not much has changed.
जब से कोरोना पीरियड आया है, अब प्रशासन इसके ऊपर ध्यान दिया है।
लेकिन प्रशासन ने ये तो जितनी दिख रही है वो 2-2, 4-4 दिन की नई बॉडी दिख रही है। इसका मतलब ये है कि प्रशासन ने अभी तक लकड़ी ठीक से नहीं दी।
अब लकड़ी वहाँ पे गिरी हुई है, अब प्रशासन लोग वहीं बैठते हैं।
अच्छा।
वहीं से सारा काम होता है।
क्या यहाँ लगता है कि जो घाट पे व्यवस्था होनी चाहिए वो है?
अरे सब क्या व्यवस्था है, यही व्यवस्था है जो है, आप देख ही रहे हैं, यही व्यवस्था है।
A government machinery that is not helping people cope with tragedy. A system that is ignoring the people and their needs. On the banks of the Ganga, there is no dignity of life left, not even in death. This report filed by Shivendra Srivastav for India Today.
So one part of the COVID numbers story that we're going to look at is death. Are the deaths being reported accurately? All those images that you saw there from Prayagraj. The other aspect is testing. Because while the overall COVID cases have come down, the question is, are they coming down because many governments are finding it hard or are unwilling to follow contact tracing, testing and tracking? Remember Karnataka, which has seen in the last week a rapid rise in COVID cases, has slowed down its testing. Nabila Jamal brings you this report, which reveals another dark side of India's COVID fight. Take a look.
Karnataka has been consistent with its rise in daily COVID cases, but the last few days have seen a sudden dip. Does that mean the lockdown has had a significant impact, or is the Karnataka government tracing and testing less? According to the state's recent health bulletin, Karnataka, which was testing 1.75 lakh a day, now tests just over 1 lakh a day. The state's positivity rate is still high at 27.84%. Mounting heat on the Yediyurappa government, former Chief Minister Siddaramaiah has accused the government of falsely projecting a dip in COVID cases.
Both Government of India and State Government of Karnataka, they have failed miserably in controlling the corona disease. It has surpassed Maharashtra. Karnataka is number one. More than 41,000. I have written more than 10 letters after this second wave is started. But none of my letters is replied by the government of Karnataka.
The BBMP defends the fall in number of tests, saying people in Bengaluru are hesitating to get tested. And since the lockdown, companies aren't getting their employees tested anymore.
As per your daily bulletins, you used to be testing 1.75 lakh, now only 1 lakh tests. Any reason for that? Any crunch in the test kits as per your analysis?
Testing has gone down because of themselves, people not opting for testing, and also because of lockdown, we are encouraging people to test more.
Karnataka has over 6 lakh active cases with 38,603 new infections and 476 fatalities reported in the last 24 hours. With Nabila Jamal in Bengaluru, Bureau Report, India Today.
So let me raise the big question tonight. Are cases and deaths being underreported in the country at the moment? Or has COVID 2.0 peaked in India and will we now see a steady decline, especially in caseload? Or is the worst yet to come? Will there be sharp disparities between the states that only widen in the weeks ahead? I'm joined by two of the country's top epidemiologist researchers. Dr. Chandrakant Lahariya is epidemiologist and has just written a book on the fight against COVID along with Dr. Rajdeep Guleria and Dr. Gagandeep Kang. And I'm joined by Professor Bhramar Mukherjee from the Department of Epidemiology at Michigan University. Appreciate both of you joining us. I want to come to you, Professor Mukherjee, first, because I remember you joined me 4 weeks ago on the show where you said you expected the COVID wave to peak around the middle of May. Then you suggested there would be about 8 to 10 lakh cases a day, 4,000 deaths a day. What we are seeing now is around 2.5, 3 lakh cases a day, around 4,000 deaths. Has India peaked, or are we under-reporting, or dare I say under-testing? Has the lockdown worked or not?
So thank you for that question, and thank you for continuing the conversation based on data and science. Yes, all models, not just ours, actually predicted the peak to be attained in India in April. The projection was early to mid-May. What we see now is, of course, the reported cases are a function of testing, we know. And I do not believe the absolute numbers at all, as you said, that they are underreported. But I do believe that you can still observe some of the relative trend, and that astronomical super surge that we saw, that is indeed slowing down.
You're saying that the astronomical surge is slowing down. Now, there are two ways of looking at it, Professor Mukherjee. One is that 20 states, according to the government, and figures suggest that caseload has plateaued. But there are also 8 states, Professor Mukherjee, where cases are still more than 1 lakh, 22 states with a positivity rate of more than 15%. So how are we to see this? The glass half full or half empty? Have we really peaked or not?
So I think the concept of peaking as a nation is very nebulous. And I have mentioned that in wave 1 as well, because some states are safe or the curve is coming down does not mean that all states are showing the same progress. Because, even last week we see that there is a cluster emerging in Assam and Northeast. So we have to be really, really careful. And I have always been the glass half empty person, because I'll always err on the side of caution rather than celebrating and declaring a premature victory again, yet another time. So I want to say that this is sort of really psychological, that because we registered 414,000 cases on a day, 350,000, 320,000, 300,000 seems smaller to us on a relative scale. But this is larger than any country in the world has ever reported on a day. So we still have to remember that we are in a precarious situation and in a very deep crisis. Hospitals are still overwhelmed and people are dying. So the concept of peak in numbers, of course, I have to say that what I see in terms of the national numbers, but whether I think that guides scientific policy, that only that quantity, of course not. We really have to look at it at a much more granular level and do our work.
I'll come to the granular level in the moment. You said the glass is half empty. One of the concerns is underreporting of deaths. Do you believe deaths are being accurately reported? We are showing stories day after day, raising questions over death reporting. As of now, India has experienced between the first and second wave over 2.7 lakh deaths, 4,000 daily deaths, the highest ever today reported 4,300. Do you believe the numbers are even greater? If so, by what number? By what multiplier?
A lot of discussion and debate has happened around this issue over the last fortnight. I wrote about this in a Hindu article as well, that how underreporting can be captured in an epidemiologic model, and then can it be verified by external data sources, because models make a lot of assumptions. So our models consistently, even in wave 1, has given an underreporting factor for deaths from 2 to 5. And no country can ever claim that they have really captured all COVID-19 deaths. So this is a common problem worldwide. But in India, this seems particularly acute in wave 2. Because I think the reporting structure is breaking, and also all the evidence that you see corroborate that the underreporting factor is higher. And I have seen several estimates, and our own estimates are that the actual number of deaths could be 4 to 5 times higher. That means that more than 1 million to 1.25 million deaths have already happened, while we are reporting around 265 to 270,000 deaths. I have to say that there is a way to validate and check if the government will actually release the mortality data, accurate mortality data in 2020 and 2021. But in general, even beyond COVID, death reporting, medical certification, reporting of mortality in a disaggregated level according to age and sex has been a problem for India. So that is really hurting us to know the truth right now. I also want to mention that if all of us have lost someone and so many families are affected, then how can the numbers be true?
I just want to persist before I come to you, Dr. Lahariya, with Professor Mukherjee on one more point, because you're making a very big point here. You're actually telling me that the death toll could be 4x to 5x. You're saying that more than 1 million people could have already died of COVID-19. You're saying experiences, anecdotes suggest so. Does the model also suggest so? Because I want to throw some numbers at you. In Gujarat, for example, a daily Divya Bhaskar reported 65,000 more death certificates between March and April 2021 compared to 2020. Government claiming only 4,218 deaths in Gujarat in this period. In Delhi, wide gap between official figures, COVID funerals. We've got rural India. We've again shown a story from Prayagraj, bodies around the Ganga. Numbers could be much higher. So you are suggesting that the numbers, what do you suggest the government do? Come clean? Come clean and tell India that more than 1 million people have died?
Yes, so that's a very good question. That and that's why we have been saying that the models are making assumptions about, fatality rates in certain age groups and what has happened. But nobody really knows the truth. That's the problem. With rural India, we have such an imperfect and data capture structure. So I really think that there are two issues here. One, to really strengthen the death reporting, and because there are some problems with the system, and also the maybe there is a lagged reporting because the system is overwhelmed right now. But also, the cause of death being misclassified as not COVID. We have heard this from several people, that it is actually assigned as certain other comorbidities. So the only way I would say that is to release exactly this kind of studies that Gujarat has done. There are alternative ways of gathering data, but we are having reports separately from different states. We need sort of a really nationally representative study. We can use other databases, for example, the cell phones that have gone silent, the social media accounts, the life insurance claims, because in absence of the data released by the government on official death counts, we have to really rely on secondary data sources and linkages to see the extent of the problem. Right now, the answer is we do not know, and science should proceed with that humility that we do not know.
Dr. Lahariya, let me bring you in now. Do you also believe that we may have peaked because caseloads are coming down, or is it that we are under testing? I see that at least 11 major states, Dr. Lahariya, we are seeing under testing, plus questions being raised now over the death count as well. Do you believe the numbers that are being thrown up by the government at the moment, or do you believe we must pause before claiming that COVID 2.0 has peaked?
Thanks, Rajdeep ji. So for a country of the size of India, what the national level aggregate data reflect only a part of the picture. So as we know that while the current situation reflects that we were going upward and then now we are moving downward. But we also know that there are a number of states, especially in southern part of the country, which are still showing some upward trend. So for a country of the size of India, we cannot say that we have peaked, and it has a limited meaning because the political and administrative boundaries do determine that how the response should be decided. So I would say that we can be assured that at national level the number of cases are coming down, but we need to be careful because ultimately the response is also mounted by the state level.
So are you also confirming to me, Dr. Lahariya, that there is a disparity in the way states are reporting? Some states seem to be a little bit more transparent with their data than others. But at the end of the day, when we look at the big picture, it might suggest that there is underreporting, which will lead to, again, a false sense of complacency. Today, the Health Ministry claimed that we are seeing a decline. We may well be seeing one, but how do I believe them unless I'm certain of the data?
Exactly. So the entire assumption, if we say that we have peaked, is that we are getting the real picture of the scenario. While the truth is, throughout the pandemic, across the world, that the number of cases which have been reported are 1/6, 1/8, 1/10 of the estimated cases. In case of India, we know through Zero survey that actual estimated cases are 20-fold of what is being reported. And as the number of officially reported cases goes down and the testing remains similar, we can say that as a multiplication factor decline. So we cannot be very confident that those are declining. As Professor Mukherjee was also saying that when we are reporting 400,000 cases, then coming down to 380,000, 360,000 does not make much of the difference, while we know the actual number is manifold of this. Right. So what we can be assured that the measures which were being taken, so the virus or transmission is not going upward, we are seeing positive trend. And trend can be actually, that's what we should be focusing attention on. And trend shows that some of the transmission is declining.
So do you think that the worst is over therefore, Dr. Lahariya? Would you say the worst is over?
I would say that the worst is over probably for cities like Delhi, Mumbai, some states, Chhattisgarh, or some other parts of the urban centers of the country. But we really don't know about the rural part of the country. We really don't know about the some other parts. And in the southern part of the country, it is still increasing. So we still have to wait.
Right.
And we also need to know that we are still at a very high number of cases. At that point of time, passing any decision judgment will be too premature, in my opinion.
You know, you're raising an important point because Professor Mukherjee, as Dr. Lahariya also suggested, one of the big changes between COVID 1.0 and 2.0 is that this time COVID is spread to the hinterland, to rural India, whereas you said earlier data reporting is even weaker. Our stories are suggesting that in many cases, when the death certificate is handed out, if I have died at home, not done an RT-PCR, not gone to the hospital, I am not deemed to be COVID positive or someone who's died because of COVID. Is that a concern when you look at the granular aspect of the data? It's now spread right across India, across more than 310 districts that are reporting 15% plus positivity rate.
It is extremely worrying that it is spreading to the rural areas. So there are many alternative ways of tapping into what is going on in rural India. And many Indian scientists actually have devised these techniques. For example, wastewater sampling, right? So that could be when you cannot test so many people, you can have an army of public health workers keeping a track of this and giving us an estimate of what is going on at a very granular district level. So I do think that there is need for like really creative solutions here. For example, using the community health workers, doing syndromic surveillance, fever surveys. We really have to find out India's solution of really tracking the data is not going to be the same as any other country, but we have to be diligent and feel really morally obliged to the people to give good data, accurate data as much as possible. Otherwise, without good data, we are flying blind.
We are flying blind. Since we are flying blind, may I ask both of you to look into the future? Because a lot of people are going to ask this question. A month from now, if I were to have both of you in the month of June, do you believe, Professor Mukherjee, that cases in India will be much lesser than today? That deaths will also be much lesser because infections will have reduced? Is the curve going to come down just as sharply as it rose in the month of April?
So that's a great question. And, I always say that the stochastic crystal ball has a finite radius. So it's hard to say, but our models right now, and most models, IHME, Imperial College London, they all show that the peak was predicted in May and the curve is going to decline, which is the good news. But we are still registering a very high number of cases. Once you go to 400,000 cases per day, you don't go down to 10,000, what we had in February overnight. So what we predict is that by mid-June, we are going to see a distinct improvement in terms of the number of cases. But it will take May and June and July to see any kind of sense of normalcy. And it also depends on how we come out of these lockdowns, right? So no city will probably be under the curtain of lockdown in perpetuity. So it will really be depending on that. And regardless of anything, we need to be high alert. There is no cause to celebrate that the peak and the worst has passed, because still the number of deaths, the number of people needing hospital care is really humongous. So we should continue to scale up our healthcare infrastructure and not really have any sigh of relief until it's over. It's not over.
Until it's over, it's not over. The good news is coming from cities like Mumbai and Delhi, where it appears there has been a sharp decline in cases and positivity rate. But what you're suggesting, Professor Mukherjee, is despite the rays of hope here and there, we are in for a long, hot, dare I say, cruel summer. This is not going away in a hurry. Am I correct?
I do think so, because, in May and June, I think there will be still people falling sick and deaths happening. I feel that maybe, and again, we do not know, again, data is hurting us, that we do not know the landscape of the variants, and are there new emerging variants and where are they spreading? So we really need to scale up our genomic sequencing, epidemiologic surveillance, healthcare capacity, oxygen production. We need to stay prepared. And I have always been of the mind that these numbers are imperfect, these projections are imperfect. But if we stay prepared for the nth wave, an outbreak, yes, it will cost us effort, but it is nothing compared to the crushing economic and social consequences you have when there is such a surge and the healthcare system is overwhelmed and people are dying.
I want to ask you this in conclusion, Professor Mukherjee. Lancet suggested not long ago that India could see 1 million COVID deaths by August. Presumably, that would mean official deaths. What is your sense? How should we be seeing what lies ahead? With a sense of alarm? Because you've already told me that you believe actual deaths are 5x. How should we see these numbers? Should we be focusing day after day on the numbers that the health ministry is releasing?
Yes, so I think that this is the problem. If you don't have a trustworthy reporting system, different models are going to project different numbers based on different assumptions, and it is very hard for the public and even scientists to synthesize that information because each model has their own set of assumptions, and what is most compatible with reality becomes a question. So the 1 million estimate, and actually the IHE comes from the IHME model from the University of Washington, and they project by August, I checked it yesterday, 1.24 million deaths. I have to say that this underreporting factors are not constant over time. You're seeing these high underreporting at the peak of the surge, but it is when the things are much more controlled, this factor actually changes. So we are projecting 100,000 deaths, our model reported deaths over the next 1 month. And I do not want to project into the future because the reality on the ground changes so rapidly. And every time I count these numbers, I feel a strange sense of discomfiture because these numbers actually represent people. And now people that I know, people that I cared about, and families, numerous families and friends that are left behind. So can we really put a number and measure to the collective trauma that the society is experiencing? So no number can do justice to that. No number, no astronomical numbers that have been thrown out in the world can actually capture what Indian society and Indian people are going through.
I think you put that very well, that you can't capture the trauma that people are going through by just throwing numbers. There is a face to this tragedy, and that's what we've been attempting to do all these weeks. Professor Mukherjee, Dr. Lahariya, appreciate your joining me here on the news today.